Drugs that affect the respiratory system work to keep the airways open and gases moving efficiently. This PowerPoint accompanies the drug chart on upper respiratory tract drugs. In the upper airway, conditions that can impact how the airways and gases move include colds, rhinitis, sinusitis, pharyngitis, and laryngitis. And in the lower airway that interferes with gas exchange include atelectasis, pneumonia, bronchitis, bronchiectasis, COPD, asthma, and acute respiratory distress syndrome. How do we know that these drugs are effective when our patients take them? First, you look at the patient. What kind of respiratory effort do they have? How difficult is it for them to breathe? What is their depth of breathing? What is their skin color? And in their test results, you look at the oxygen saturations, chest x-rays, and blood gases to assess for drug effectiveness. Upper airway drugs include antitussives, decongestants, expectorants, and mucolytics. Antitussives block the cough reflex, acting centrally in the medullary cough center, or they can act locally as an anesthetic to decrease irritation that has caused that cough. Decongestants decrease blood flow to the upper respiratory tract and decrease overproduction of secretions. And expectorants increase productive cough to clear the airways. A mucolytic is used to increase or liquefy respiratory secretions to aid in the clearing of the airway. We will talk about each of these. The site of drugs working is a chart that is found in your textbook, and you can look at that chart to see where the drugs work in the body to impact airway exchange. The antitussive we have chosen is dextromethorphan. It is used to treat non-productive coughs, and it works in the medullary cough center to depress cough reflex. Patients who need to cough to clear their airways should use these drugs with caution. For example, a postoperative patient who needs to clear their airway should probably not use an antitussive to impact their cough. Patients who take these drugs should avoid grapefruit juice as they interfere with the effectiveness of the drug. Adverse effects of the antitussives include dry mouth and GI upset. They can cause drowsiness and sedation if the drug also contains an opioid like codeine. If you are using an antitussive for more than 1 week, the patient should be cautioned to see a healthcare provider to find out the source of the cough, because it should have cured itself within a week unless there's an underlying condition that needs treatment. Non-pharmacologic measures to relieve cough you probably learned and reflect upon from your fundamentals course, including increasing the humidity in the air, keeping the room temperature cool, increasing the fluid intake, and the use of topical lozenges to help control the cough. There are 3 types of decongestants. The first type is a nasal decongestant or a topical decongestant called oxymetazoline. It can cause vasoconstriction of swollen mucous membranes and is used to decrease that edema. It is used for nasal congestion, and the problem that we have with that is that if you use it for more than 3 to 5 days, you can develop rebound congestion. We'll talk about that again in a moment. Please be cautious with these drugs in the presence of lesions or erosions of the mucous membranes that can lead to systemic absorption of the drug. Please look at your box on patient teaching about administering nasal medications. The oral decongestant that we chose was pseudoephedrine, which is used to stimulate alpha and beta adrenergic receptors in the nasal passages to promote shrinking of these passages. It peaks in about 20 to 40 minutes after the drug is taken. It's used for nasal congestion and the pain and congestion of otitis media or ear infections. Please again review the safe administration instructions in the textbook. Side effects of the pseudoephedrine include anxiety and nervousness, dyspnea, and palpitations, hypertension, and an increased pulse. The drug can also cause anorexia. You should avoid pseudoephedrine if the patient has glaucoma or cardiovascular disease because of the palpitations and increased heart rate that are side effects of the drug. Patients with diabetes mellitus and thyroid disease should use pseudoephedrine with caution. And the drug has many drug and drug-food interactions. A topical steroid that can be used to impact local inflammatory and immune modifier and is not systemically absorbed is fluticasone. It is used for seasonal and non-allergic rhinitis. Locally, it can cause burning and irritation and dry mucosa of the nasal passages and can also cause a headache. You need to monitor the patient because as a steroid, it increases the risk of infection. Patients with glaucoma or nasal trauma should not use this nasal steroid. You need to caution your patient that it may take 2 to 3 weeks of consistent use to see the benefits of this drug. A problem with nasal decongestants is rebound congestion. If you use these drugs for more than a week, it can lead to a rebound vasodilation of the nasal passages and nasal damage and inability to respond to a decongestant in the future. You have a section in your textbook that describes this in more detail. Antihistamines have 2 generations. Histamine is released during inflammation and it increases secretions and narrows the passageways. Antihistamines block this action at the H1 site. The first generation antihistamines include diphenhydramine. It has greater anticholinergic effects and can cause drowsiness. The drugs are used for rhinitis, urticaria or itching, motion sickness. Some people use diphenhydramine as a sleep aid, and it can be used to counteract allergic reactions to blood transfusions. Again, it is sedating and causes drowsiness. Newer non-sedation or second generation drugs that are antihistamines include loratadine. It is less sedating. It can have the same decrease in allergic reaction by blocking histamine, but without the sedation, and is typically used by patients with allergic rhinitis, particularly if that patient needs to go to work during the daytime and avoid that daytime sleepiness that occurs with a first-generation drug. The drug of choice is based upon the patient's reaction. Note that these drugs can cause excitation in children, and special care should be used with these drugs for patients who have extended QT times, that resting port in the heart rate that we've talked about earlier in the semester. Antihistamine adverse effects are related to those anticholinergic effects. They dry the membranes of the respiratory and GI tract. They can cause urinary retention and blurred vision. If you are using these drugs with MAO inhibitors, they prolong the anticholinergic effects. So if the patient has conditions such as benign prostatic hypertrophy, or they tend to have urinary retention, you need to ask them to empty their bladder prior to taking the antihistamine. Patients should also avoid alcohol and should increase fluids while taking an antihistamine. A common expectorant is guaifenesin. It is used to treat a dry, non-productive cough. It helps decrease the adhesiveness of secretions, which results in them thinning, and you are now able to have a productive cough to get rid of the secretions. You need to identify the underlying cause of the cough. Therefore, again, if the patient has a cough for more than a week, they need to seek medical attention to find out the underlying cause. Guaifenesin should be taken with a full glass of water, and liquids should be increased in order to help thin those secretions. Again, you should not use this drug for more than a week. Mucolytics include acetylcysteine. It is delivered in either a nebulizer or by direct instillation into the trachea to liquefy secretions. The drug facilitates airway clearance in patients with cystic fibrosis or atelectasis. Orally, you can give the drug as an oral drug to protect the liver in acetaminophen toxicity. If you administer this drug with a face mask, it's important to wipe off the excess liquid from the skin with plain water to prevent skin breakdown. Side effects include GI tract nausea and stomatitis, bronchospasm in the respiratory system, and urticaria. For review, questions at the end of the chapter. Please review box 54-2 on administering nasal medications. You may have a test question on how to instruct a patient to administer a nose spray. And you need to look at the nursing considerations for the mucolytics and the administration of nebulizer medication.